Hello everyone, this is Dr. Anmol Paudel. I'll be talking to you about the portion of the nephrology part. First of all, I would like to talk about the embryology of the kidney. As you know, all human beings develop from a small zygote which develops into three layers, that is ectoderm, mesoderm and endoderm. Then it forms the adult human being. Kidney develops from the intermediate mesoderm. As you know, adult size of the human kidney is 9 into 3 into 9, 12 into 9 into 3 centimeter. The location as per the vertebral level is T12 to L3 vertebra. And you should know the basic concept of the pronephros, mesonephros and metanephric kidney. Pronephros functions as kidney till the 4th week of life, then it degenerates. Mesonephric kidney function till 12 weeks of life, then and degenerates. Lastly, it is the metanephric kidney that develops into adult kidney. So metanephric kidney basically has two parts, that is ureteric board and metanephric mesenchyme. So ureteric board develops into all the collecting system. The collecting system that includes is ureter, pelvises, calyces and other collecting ducts. Whereas the metanephric mesenchyme forms the glomerulus, PCT and distal convoluted tubule. So what you have to know is metanephric mesenchyme forms the glomerulus, the filtrating part. Ureteric board mainly form the collecting part. So when there is an interaction between the metanephric mesenchyme and the ureteric board, the adult kidney is formed. But once there is some errors of recanalization of metanephric mesenchyme and ureteric board, then there can be some sort of congenital pathological condition. Uretropelvic junction obstruction is the most common congenital site of obstruction, as it is the last part to canalize. So when a baby develops, the uretropelvic junction is the last to canalize and the most common site of obstruction. Early detection of hydronephrosis in prenatal USG suggests pelvic-ureteric junction obstruction. So you have to do the anomaly scan, dating scan, if you suspect such condition. Trigone of bladder develops from mesonephric duct, whereas all parts of bladder develops from endoderm. This is the high point. Actually, our bladder develops from the endoderm, but one part of the bladder that develops from the other than endoderm is trigone. It develops from the mesonephric duct. Now let's talk about the congenital condition as we face many times in our medical practice. It is horse-shaped kidney. It is the most common congenital anomaly of the kidney. Abnormal fusion of inferior pole, mainly inferior pole fuse abnormally, gets trapped in the inferior mesenteric vein, which is associated with Turner syndrome, trisomy 13, 18, 21 and also Wind's tumor. So what happens is that the inferior mesenteric vein traps the lower poles of the kidney, and the fusion of the lower pole of the kidney takes place, and it gives the size of the horseshoe shape. So people call it horseshoe shaped kidney. As you can see in the figures, your inferior pole of the kidney is fused. Okay, yeah, here in the CT scan also you can see this is the inferior this is the inferior vena cava, this is the horseshoe shaped kidney. Okay. Some high points I like to talk here. There is one rule called Meyer-Wigand rule. It says that in congenital double ureter, superior moiety opens inferior medially and vice versa. The ureter that arises from the superior part of the kidney opens into the inferior medial part. It means when there is two ureter in a developing embryo, the ureter that starts from the superior part opens inferior medially, and the ureter that starts from the inferior part opens superior medially. Another golden point is there, water lily sign is seen in drooping lily sign or water lily sign. Drooping lily sign is seen in duplex collecting system of the kidney. Another question most commonly asked in many entrants, including the India, Nepal, and other countries. Cobra head sign is also seen in ureterocele. Flower bucket kidney, one of the most important point, that is medullary sponge kidney. This is also asked in many countries, many medical entrance examination. Now you should know about the concept of the renal angle also. The renal angle is the angle between the 12th rib and erector spinae muscle. What happens is any person that who comes to the OPD if complains of back pain at the 12th rib and erector spinae, you suspect the nephrolithiasis. One question I would like to ask you, that why people prefer for the left kidney for transplantation. The reason is the left vein has a longer course than the right vein. That's why people prefer left kidney transplantation than the right. And one thing you should know, medulla of the kidney is more sensitive and susceptible to hypoxia than the cortex. Now let's move about the fluid compartment of the human body. 60% of the human body is made up of water, out of which 40% is intracellular fluid and 20% is extracellular fluid. Means 40% of the part of the kidney is not consist of water. 60% of part of our human being is water. Now you should know how to measure ECF. ECF is measured by inulin, mannitol, sucrose, radioactive sodium raffinose. ECF. Extracellular fluid, we use inulin, mannitol, sucrose, radioactive sodium raffinose to measure extracellular fluid. Similarly, D2O tritium oxide antipyrine measures total body water. Evans blue radioactive aluminum measures the plasma volume. So you can't measure the intracellular fluid because it's inside the cell. Common logic. What you do is you subtract the total body water. You subtract the total body water from the extracellular fluid. It gives you intracellular fluid. For example, if a 70 kg man is 42 if in a 70 kg man 42 kg is equal to 42 liter of total body water. It means say a person who is 70 kg in weight has 42 liters of water, out of which 28 liter is inside the cell and 14 liter is outside the cell. One question was asked in the medical entrance examination: cystatin C level is similar to inulin clearance. This is the past question of the main entrance examination. Kidney. Finally, you should also know what is the cardiac output that every organ receives. Right now, I would like to mention you that kidney receives 20% of the cardiac output, and the flow rate is 1200 ml per minute. This is the fluid compartment. I have taken the figure from the USMLE 1st day 2022. Here you can see body mass 70 kg person has total body water of 42 liter because 60% of body is made up of water. Then non-water part of the body is 40%. There is 28 kg is non-water part. I already told that. You can see it's for the figure. It was explained already. Now let's go about the glomerular filtration barrier. You should think that our kidney is the main excreting part of the body. It filters that are the things that are important to our life and excrete the things that are not important to our life. For example, urine consists of urea, creatinine, some of the other urobilirubin and other things. It means the function of kidney is to filter the things that are needed to our body and to excrete the things that are harmful to our body. So glomerular filtration barrier is composed of your fenestrated capillary endothelium, basement membrane with typocollagen and epithelial made up of podocyte food processes damage in minimal changes. I have given you the example of, suppose if there is damage to the fenestrated capillary endothelium, the disease is membranoproliferative glomerulonephritis or diffuse proliferative glomerulonephritis. If there is damage to basement membrane typhocollagen, the disease is Alport syndrome. Very important. Similarly, epithelium made up of porocyte and food processes. You know that the change in the minimal change is just loss of food processes. There is no major change. Okay. All these three layers here, charge barrier, prevent leakage of molecule like albumin in the urine. So do you excrete albumin in the urine? No. So net protein loss of a healthy adult in the urine is 0. Thank you.